Hi folks, today is Friday, January 15th, and quick video and memo going out today. This will be quick because it turns out I've herniated a disc in my back, and so standing and sitting are not my friend right now. I had a 10-pound baby. This hurts more, so I'm going to talk quick and hopefully loud enough for you. The biggest issues on our minds right now are vaccination clinics for our independent living residents. Earlier this week, the federal government announced the next phase should be for everyone 65 and above, and the governor in yesterday's press conference said that for New Hampshire residents that would start January 26th with online sign-ups beginning January 22nd. We are trying to keep you out of that process. That's the sort of the standard state process. It would include an online portal and then driving to one of the fixed sites that the state has. We are working every day with the state government, the Department of Public Health, with the governor and his staff to allow us to provide those vaccines on site at your home to you, either through the CVS program that we use for our healthcare residents, or to do what they call a closed point of dispensing, which is essentially the state allocates the vaccines to us, we handle all the administration, the paperwork, put the shot in your arm, notify, give you your second dose also. So where we are today, I know you wish we had more information, and I will tell you I wish we had more information. I can tell you we are in touch with the appropriate people every hour pretty much. We expect that by next Tuesday we will have more information as to whether you'll be in the standard program or we'll be able to do it on site. I think what I'd just ask you to do is hang in there. You can't sign up until next Friday anyway. We'll know before then whether you should. If you get information from your primary care provider or from other sources, feel free to read it and save it. My hope is that you won't need it, that we'll be able to do it on site. We're putting every resource we have available here within our Riverwoods communities and the CCRCs across the state, trying to make sure that we can have this happen for our independent living residents. So that's vaccines. The second thing is just related to positive cases. You know, the number of positive cases in our state has been going up. Actually, number of COVID cases essentially doubled in the last month, but that's not good. And we have had an uptick in cases, positive cases mostly from our staff through our state surveillance testing in the last, really since November. We do testing of our state surveillance testing of our healthcare residents and staff every week. We do our wastewater testing twice a week, and then we also test symptomatic staff or residents whenever that should occur. So it's not really practical for us to give you an update every time we have positive cases, but I do want to let you know we have, over the last several weeks, we have uncovered generally asymptomatic healthcare residents at each campus. Most of those have resolved. We had at one point or another, one or two at each of our campuses. At this point, we have one asymptomatic healthcare resident who lives at the Woods Health Center of our Riverwoods Exeter campus. We also have this week uncovered positive cases, 2 positive IL, independent living residents, at our Riverwoods Exeter Ridge campus. We had a resident who was symptomatic, test positive. That leadership team did contact tracing, uncovered another resident who was in this person's social circle, tested positive, asymptomatic. At that point, the leadership team there decided, and I think very wisely, to quarantine that campus, the Ridge campus, and test all independent living residents. We expect those results back hopefully tonight, but more likely tomorrow, in which case we'll provide more information to everyone early next week. So those are really the updates for today. I think the last thing I would just say is, this is getting long and we're all sick of it, but we're getting there. We'll find a way to help you get your vaccination if you live on the independent living side. If we're not able to convince the state to allow us to do it on site, we'll help you through the sign-up process. We'll figure out ways, some combination of you, perhaps your family, and Riverwoods, help you through that process. We're in this together. It's in our best interest to have, in your best interest to be vaccinated, and in our community's best interest to have everyone vaccinated. We'll do everything we can to help. Until then, wash your hands, wear your mask, keep your social circle small, and stay healthy, my friends.